Class of 2023. Part 1, Tuesday night at 7:30 on PBS Hawaii. For updates on your favorite programs, follow PBS Hawaii on Facebook.
You're watching PBS Hawaii, supported by viewers like you. It's not just TV, it's life. PBS Hawaii, home is here.
Local broadcasts of Insights on PBS Hawaii are made possible by the support of viewers like you. Mahalo, and by First Insurance Company of Hawaii, protecting Hawaii's families and businesses since 1911. Ulupono Initiative, building a more sustainable Hawaii by investing in local food, renewable energy, clean transportation, and waste and freshwater management. Hawaiian Electric. To learn about our commitment to sustainability and reducing carbon emissions, visit hawaiianelectric.com/sustainability. Carl Smith Ball, providing legal services throughout Hawaii and the Pacific since 1857, making a positive difference in the communities where we live and work. Federal officials approved a new COVID-19 booster shot for most people as the country heads into another holiday season. The booster is billed as providing enhanced protection against COVID-19 variants currently circulating around the country. How many people will actually get the shot? What should you do? What is the status of the coronavirus? Join the conversation about COVID-19. It's still here, tonight at 7:30 p.m. on Insights on PBS Hawaii.
Aloha and welcome to Insights on PBS Hawaii. I'm Lauren Day. The severity of COVID-19 pandemic has faded, but there are still thousands of hospitalizations and hundreds of deaths each week in the United States. Hospitalizations have been increasing since late summer, and some experts worry that immunity from previous vaccinations and infections are fading. An updated COVID-19 shot that targets a more recent variant of the virus should now be available through healthcare providers statewide. So what can we do to protect against COVID-19 and avoid another surge in numbers this upcoming winter season? We look forward to your participation in tonight's show. As a reminder, you can email or call in your questions. We also have a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests in studio, we have Dr. Sarah Kemble, the state of Hawaii's epidemiologist and chief of the Disease Outbreak Control Division. She received her MD from UCSF and completed her residency at UCLA. She is also an alumna of the Epidemic Intelligence Service Fellowship Program at the Centers for Disease Control and Prevention. Hilton Raethel is the president and CEO at the Healthcare Association of Hawaii. He has worked in the health industry for 32 years, including the last 20 here in the state. Prior to his current role, he worked for 10 years at Hawaii Pacific Health as vice president for contracting. Dr. Gehan Devendra is a pulmonary and critical care physician at the Queens Medical Center and the director of medical education critical care for the University of Hawaii Internal Medicine residency program. He sees patients who have pulmonary complications due to long COVID. We also have in studio Angela Keene. She is a former Hawaii media personality and worked as a reporter and TV anchor for more than 15 years. After recovering from COVID-19, she has battled long COVID. We will get to her story in just a bit. But Dr. Kemble, I want to go to you first. Can you give us sort of the landscape of where we are today here in the state of Hawaii as far as COVID-19 goes?
Sure. So while we are seeing now a downtrend overall in COVID-19 cases, test positivity, and hospitalizations, I would say in the overall landscape, it is still very possible that we could continue to see a surge later this year. We've seen that with COVID before, where we'll have some peaks and valleys. As you mentioned, during the summer, we actually had a fairly steep increase in COVID-19 cases, hospitalizations, and that came at a very difficult time. But we're now seeing that start to level out right now.
Hilton, how are our hospitals across the state doing as far as COVID-19 goes?
Our hospitals overall are doing very well. Right now we're averaging on any given day between 70 to 80 positive COVID positive cases each day. Those are patients who are inpatients in our hospitals who have tested positive for COVID. Now, many of those are incidental COVID. They are in hospital for some other reason, and they were tested and found to be positive with COVID. So the number of patients being treated for COVID in our hospitals is actually quite low. The number of patients, we only have less than, well, today we had 7 COVID patients in our ICU, but again, some of those are incidental. We did have a small surge of COVID hospitalizations in mid-August, where we got up over 100 COVID patients a day for a number of days, but that has actually gone down just a little.
Can you talk a little bit about maybe the severity of the cases that we're seeing when it comes to COVID right now?
Well, the good news is that the severity of illness for COVID is not severe at this point in time. So there's quite a bit of activity. The positivity rate, as Dr. Kemble said, has come down a little bit, but it did get up for some days. It was up around 20% of the cases that were being tested. So we had a positivity rate of around 20%. It has dropped down. Now it's back down into single digits again. So there's a fair amount of COVID around. A lot of people are testing positive, but in terms of severity of illness, fortunately, we're not seeing a lot of people really sick with COVID. Now, it's still a problem because some people can get very sick. People can still die from COVID. But overall, the level of severity is what we've been seeing in the last few months is nowhere near as severe as it has been in earlier stages with some of the earlier variants.
Definitely good news to hear that it's not as severe, but I know, we have folks like Angela here in studio. When you are someone who has experienced long COVID, I'm sure to hear that it's not as severe, you probably want to share your story as well so that folks know that the risks out there. Angela, I know your story is one that we want to get to, but first of all, how are you doing today?
I'm doing great. I'm about 90% back to normal. It did affect neurologically my brain. That part has been resolved, and I still have a few physical issues left, with my body, surgeries and things that need to be fixed due to long COVID, but my brain is great. I'm thinking great. I'm back to work, and I'm a very happy person.
That's awesome to hear. So glad to see you smile as well. I want to hear a little bit more about your symptoms and what you experienced, but first, Dr. Devendra, can you talk a little bit about what exactly is long COVID? I know you treat patients who have had long COVID like Angela.
So long COVID is anyone, if you use the CDC definition, those individuals who have had COVID and are 30 days or more after their infection and still have persistent symptoms. It could be brain fog, cognitive dysfunction, it could be shortness of breath, it could be cough, it could be hair loss, it could be numerous other things. Even sleep disturbances can be could be the result of long COVID. And so these are some of the symptoms that we do see. I primarily treat lung-related complications of long COVID, and these really we need to think about how, of all the people who do get COVID, up to as many as 20% of people can develop long COVID on those people who have had COVID. So it's still something that we need to be vigilant about, and that we need to make sure that people find the help that they need when they have these symptoms.
Mm-hmm. What is your recommendation as far as the best way to protect yourself against COVID-19?
Well, first, if you do develop COVID and you do get COVID, one of the most important things is make sure that if you're in the right age group to get treated with Paxlovid. We know that with Paxlovid treatment that you can actually reduce the the chance of getting long COVID. So that's one thing. The other thing is make sure that you're immunized. You have your immunization, because immunization will reduce the severity and the likelihood of getting long COVID. So those are two reasons to look forward to protect yourself. Also, use common sense. If you have underlying health illnesses and you need to avoid places where there are a lot of people there, or if you do, just mask up. Mm-hmm. And so some of those things will help reduce that incidence of not only acquiring COVID, but also development of long COVID.
Dr. Kemble, I want to talk about the latest COVID-19 shot. How is it different from the previous round of shots, and who would you recommend get it?
So the new COVID-19 shot is created to more closely target current circulating strains of COVID-19. That's the biggest difference. It's really, it's still an mRNA vaccine. It's still based on the same principles and science as the older vaccines, but the targeting of the strains towards current strains, this is becoming more like how we think about flu vaccines. You target the circulating strains for the current season so you get the best protection.
Mm-hmm. Hilton, you and I were chatting about this before we went on the air, but can you tell us a little bit about the difference in wording between a booster and a vaccine or a shot?
Well, the CDC is recommending that the current shots that have just come out actually not be called a booster, because technically it's not a booster. It actually is a different formulation based on the same technology as Dr. Kemble said. But it is a different formulation. And just like we have flu shots every year, we don't call the flu shots a booster because those flu shots do change, or the vaccine actually changes from year to year. So we're in this stage now with this disease that it's going to be with us just like the flu is, and that it's expected that the recommendation is going to be that maybe once a year, hopefully not more than once a year, that people do get their annual annual COVID shot. Mm-hmm. So again, we're trying to discourage CDC, health professionals are trying to discourage the word of the use booster, because it really doesn't apply to the way the vaccines are being used now and the way they're being formulated.
Mm-hmm. And with the COVID-19 shot, can you also get the flu shot at the same time, or do you need to spread out between those two vaccines?
I would defer to the physicians on that.
It's safe to get and effective to get flu and COVID vaccines at the same time, even additional vaccines like RSV, since that's another of the big three that we're thinking about this respiratory season.
Dr. Kemble, I have a question for you from Mike from Makiki. He said, took the new COVID shot today and I'm going to Vegas in a week. How effective will it be against the new variants?
The formulation of the shot is designed to be maximally effective against the current circulating COVID strains. So that is the idea about getting the new vaccine, is get that new shot before you travel, because what you may be exposed to in new places, you're more likely to have maximal protection through the new vaccine.
Mm-hmm. Angela, I want to go back to your story. You first got COVID very early on in the pandemic. It was March of 2020. We didn't have a COVID vaccine booster. We didn't have anything at the time. No one really knew what was going on even at the time. Can you share a little bit about your story? I know that you said that you were sick for quite a while that first time around.
I was performing a wedding as a wedding minister, had a couple come from Australia, and someone was carrying the virus, and we just didn't know it. I was sick for 8 weeks. At the very beginning, I was pushing for testing and was even calling the media to ask for testing, and it finally came. It was too late for me, but I was able to confirm that I had it. There was no treatment at that time, so I was sick for 8 weeks.
Wow.
I would leave my mother videos, I would send her videos in the middle of the night because I was afraid that I wasn't going to wake up the next day. I was constantly in contact with my PCP, my primary care physician, and she felt that I had enough medical knowledge and experience and medical equipment and treatments that I could ambulate at home. And so I did. I ambulated at home for 8 weeks. Following that was this cascade of medical issues, and it started with my brain. I had memory issues. I was forgetful. I failed 6 different medications for ADHD, for memory, antidepressants. I developed severe major depressive disorder. I was suicidal. I'm not someone who believes in suicide. So there was a point that I had to reach out far beyond what most people do. And I found a physician named Dr. Jason Kiefer. And he's a brain specialist and psychiatrist. And through his treatments, I've been able to recover by about 90%.
Wow.
And now I work for him, so.
That's amazing. Any advice that maybe you have to other people out there still struggling and still dealing with their long COVID symptoms?
Absolutely. I get inquiries and messages from all over the world. I think that patients have to be their own advocate. They have to go beyond what their PCP can do for them. The challenge here in Hawaii is that it can take months to see a specialist. It can take 5 to 6 months to see a lung specialist. It can take 2 to 3 months to see a gastroenterologist or an immunologist or a rheumatologist. So there needs to be patience and persistence. And for people who do think that the virus is just manini or not a big deal anymore, I want to always have people think about long COVID, because even if you have a minor case of COVID, long COVID is very, very real, and those symptoms can last persistently for months and years for some people.
Dr. Devendra, hearing Angela's story, is that something that you see quite often or still regularly, even though we are now almost 4 years later into the pandemic?
Absolutely, because even though I see mostly lung-related long COVID, my lung patients will say, you know what, I'm not thinking the way I used to think. I forget. I can't do the things from higher level functioning that I used to do. And so this is a very common thing that we do see, and the reason for it is really unclear. And I think more of the science needs to be looked at to try to figure out why do people with long COVID and cognitive dysfunction, why is that happening? And so I think my plug, if you will, for more research on this is absolutely important.
Doctor, how do you determine if someone has long COVID? Is there a test for it, or how do you know, their symptoms or what they're experiencing is from the coronavirus?
Right. So it's mostly from the history, because my patients will say, you know what, I felt fine, I've been doing well, and very similar to what Angela was saying. I feel fine, and then I got coronavirus, and then after that, 30 days later, I kept the shortness of breath. I still had my shortness of breath. I couldn't get better. So that history part is really important to know, because, and we've seen this in some of our studies, that some of our immune markers are even elevated, even long term. So we don't have a single test at this point, but the history is very key, and right now we're doing investigations to see if we can find a better test, the reason why.
Since we're on the topic of long COVID, Ingrid on Facebook is asking, can't people get serious long COVID after mild cases? Happened to my Bay Area friend who ended up hospitalized and is still in pain. It's not resolved.
Absolutely. You don't have to be hospitalized to get long COVID. So although the incidence of long COVID is higher in those who have been hospitalized, even with mild cases of COVID, you can develop long COVID symptoms.
I know Hilton, Dr. Kemble, all of you have been advocating for getting the new COVID vaccine. What would you say to those who are reluctant to get vaccinated against COVID, maybe second, third time?
Well, first, I just want to say how powerful the story that Angela shared is, and folks who work, the very dedicated folks who work at Department of Health, continue to hear a lot of those stories as we follow up cases as well. And I think that part of the human story is part of the reason why these shots are really a great advantage that we have now, and so important to take advantage of. We're very fortunate in a way to have such an effective and safe vaccine. And so I think the key now is, how do we use that to our best advantage? And it's really making sure people understand that the shots are safe and effective, and that there's value in getting them, that you can prevent serious illness that might occur because of COVID-19.
We have a caller from Punahou asking, I'm 85 years old and have 7 vaccinations already. Should I get the RSV vaccine? Is that something, Dr. Kemble, maybe you could comment on?
And I did mention we're now sort of looking at the triple-demic of COVID, flu, and RSV. RSV stands for respiratory syncytial virus. It's another, essentially a common cold virus, but it can be quite serious, especially for infants and for older folks, for kupuna. So there is an RSV vaccine available now for people 60 and above. And it is effective at preventing RSV in those groups. And so that's another vaccine that you can get now for protection.
Is there any sort of maybe a concern people should have about getting, you know, maybe it be the RSV, if you have to get the RSV vaccine, the flu vaccine, and then COVID vaccine, or can you get all of them at the same time or close to each other?
So according to the CDC, it is safe and effective to get all three at the same time. Often it's hard to get in multiple times for different visits, so if you have the opportunity to go in and get all at once, I do recommend it. If you're not able to get all at once, you can still get them spread apart. But
we have a couple viewer questions still on the topic of long COVID. Angela, are you still experiencing any long COVID symptoms? Or I know you had mentioned about 90% recovered.
I'm about 90% recovered. Interestingly enough, last May, that was kind of my ending long COVID. I had gotten better. I was triple vaccinated, but unfortunately, that was May. In July, I got COVID again. I was only sick for 5 days, and my long COVID reignited, unfortunately. So since last July, about a year ago, a little over a year ago, I've been working on myself, working on everything with treatments, and I would say I'm about at 90% back to normal. The most important is that my brain is back online and doing better, and I have no depression. But I think the other things that I struggle with are structural issues, ENT issues and autoimmune issues that might be physical in nature. But for the most part, I would say 90% I'm back to normal.
Dr. Devendra, we have Norma from Manoa asking, my husband also had long COVID, but he also has pulmonary fibrosis. What is the best treatment for this?
For the most important thing is make sure that you are having a good relationship with your primary care physician and your pulmonologist. If you have pulmonary fibrosis, you most likely have a pulmonologist. So the issue is there are some of my patients who have underlying lung disease like this individual has, who do then get COVID. They're at high risk, so it underscores the importance of vaccination, early treatment with Paxlovid if you get it, if you do get COVID. Those are the most important things. And then from the other standpoint of what can you do about it and how can you get better from it, so a lot of times there's a tincture of time that is necessary, but unfortunately we don't have any pill or anything like that that can help solve that. So for this individual, I would say it's important to have that connection with your primary care doctor or your pulmonologist to help you sort through some of those issues of shortness of breath. And then one of the most important things that is really exercise. Trying to stay a little bit active if your oxygenation is adequate, is to try to stay active. Those are things that can help, and also things that'll help your mood, etc. I think that's really important. The psychological issue, it really helps you combat the other symptoms of long COVID. So making sure that you're mentally well, making sure that you have a support system, faith, if that is important to you. All of those things are going to be important to you.
I think he's raising some very, very good points about health in general, how we should all be taking care of ourselves. And that's something that gets lost. We talk about the vaccines, we talk about Paxlovid, we talk about other types of treatment, but there is very clear evidence that people who are healthier, doesn't mean you're not going to get COVID, it doesn't, and some very healthy people can also die from COVID. But very clearly, people who are healthier, who take care of themselves, generally do better. And so, there are exceptions, unfortunately, but we all need to take care of ourselves. We should be drinking lots of water, we should be getting exercise, we should be getting good sleep. That's good for any disease, including, fighting against flu, RSV, COVID, or anything. So having a good relationship with the PCP, going for annual checkups, taking care of yourself, eating well, those are all good things that we should be doing. And it was demonstrated during the pandemic, and who knows what's going to come up next. There's probably going to be another disease at some point that comes up. So the more we can do to take care of ourselves, be healthy, gives us a much better chance of fighting off these diseases.
Hilton, what do you think are maybe some of the lessons that we have learned throughout the pandemic? You and I were chatting earlier about the flu and how those numbers kind of dropped off once COVID came around, and a lot of that had to do with people being healthier and maybe sanitizing more, that sort of thing.
Well, it's pretty amazing. And if you look at the numbers that the Department of Health was producing, and they track, the flu's incidents across the country, and they track the number of deaths and the number of people who test positive for the flu. That dropped off dramatically in 2020 and 2021. So basically, we didn't have a flu season in many parts of the country. People were social distancing, people were washing their hands frequently, people were wearing masks, they were taking care of themselves. And so it was remarkable just how dramatic the change between 2018 and 19 and then 2020 and 2021. And then as people started to get fatigued with wearing masks and the hand washing, they just got sick of dealing with COVID. They thought it was going to be inevitable anyway. So they stopped those precautions, or the incidents, or the lot less people were taking care of themselves, and the flu vaccine or the incidence of flu came back up again. So very, very clear correlation between, especially for respiratory diseases, between taking care of yourself, wearing the mask, social distancing, and the incidence of the flu.
How are our hospitals doing as far as staffing goes? I know there was a point during the pandemic where every healthcare facility was stretched thin. I'm sure doing a lot of the things that you mentioned, masking up all of us, washing our hands, also helps out our healthcare workers as well.
Well, it did, but we were very severely stressed during at least the two most, we had two major surges during the pandemic, and the Delta and the Omicron surges. We ended up having to bring in over 800 staff from the mainland to take care of patients in our hospitals. Now, fortunately, we got through that. We're able to get some very significant amounts of FEMA funding to help us do that. Really appreciate the partnership with the Department of Health to make that happen. We're doing much better now. Right now, we're looking at about 2,300 to 2,400 patients a day across the state. Now, that's still higher than what pre-pandemic, we used to run around 2,000 patients a day statewide, so it's still materially higher than what we were, but it has come down a little bit. Now, staffing is still a challenge. On any given day, we probably have about 350 to 400 staff from the mainland in our hospitals, which is still a lot. We're working very hard to recruit staff. We're working very hard to grow more staff, to expand our nursing programs. But there's a shortage of workers in many industries, not just healthcare. So staffing is still one of the single biggest challenges that our hospitals are facing. Even though for nurses, we pay the second highest salaries in the country. California pays the most for nurses, and we pay the second highest. But even with that, we still have challenges getting enough nurses here in the state of Hawaii.
And I did want to add that the staffing issues in Hawaii are part of what make our public health situation unique as well. So while getting preventive care like vaccines is important for your individual health, it's also important for the health of the overall community. And it's in part because we have a fairly thin margin to overwhelm our healthcare systems here. We run at fairly full capacity. And so when you look at something like COVID alone, perhaps that won't push us over the edge, but if you look at COVID coinciding with flu, coinciding with RSV, you end up with a real near crisis situation. And so that's something that we always have to keep in mind as we think about how do we protect the health of our community here in Hawaii.
Dr. Kemble, we actually have quite a few questions about the new vaccine. Cheryl from Kula is asking, how long after you have COVID are you able to take or get vaccinations, and not just the COVID vaccine, but also flu, RSV as well?
So after getting COVID-19, there's no reason you can't get vaccines. Getting the COVID vaccine right after you've had COVID may not be very useful because your body has already mounted an immune response, and so you have some immunity built up. And it's likely from a current circulating strain that you just got. So the recommendation from CDC is to wait about 90 days after having had confirmed COVID before getting the new COVID vaccine. For other vaccines, you don't need to delay. I would wait until you've fully recovered from your COVID-19 and then go in to get your other shots, but you don't need to have a specific waiting period.
This one is also for you, from Eric from Kaimuki. Do the people getting COVID now have any idea where they got it? Are family members also sick? Is contact tracing even part of this anymore?
I think a lot of people don't necessarily know where they got COVID-19. You might realize that you were around somebody else who was ill, and if they've tested, you might know that they have COVID-19, but it is a common respiratory virus now, and it's out there circulating. So there's always a possibility you picked it up at the store or when you were in a crowded setting somewhere. So it's hard to know. Testing can still be helpful, and as Gehan was saying, it's very important because you can get appropriate treatment if you know that you have COVID-19, especially if you have risk factors for more severe disease. And knowing whether it's flu or COVID now is quite important as we start to see both viruses circulating, because there's a different treatment if you have flu. So you want to make sure you're getting the appropriate treatment for the condition that you have.
Doctor, can you share what should someone do if they test positive for COVID-19, just in case our viewers, might not be up to date with the new rules, I guess?
Well, first, I can't stress the importance of really interacting with your primary care physician. First, having a primary care physician and interacting with them so that they know your problems most, because they know the medications you're under. The next thing is if you're in a high-risk group, and then it's important that within 5 days that you start your Paxlovid. So it's really getting on top of that, and depending on your other medications you're taking will change the dose of the Paxlovid. So it's really important that you know what you're taking. Your physician, your primary care physician, knows what you're taking to give you the appropriate dose of the Paxlovid.
Is the rule of thumb still quarantine? Is it 5 days or 10 days?
So the rule, I'm going to defer that to Sarah, but I've been telling my patients 5 days, and so or they're free of symptoms. So they're not having fevers, they're not having cough, but if they're having fever still, even beyond the 5 days, I say you need to self-isolate.
Yeah, that's correct. So the CDC guidance is still that if you know that you have COVID-19, you should isolate for at least 5 days, and also make sure that your fevers are gone and your symptoms are getting better. If you're still having fevers or serious symptoms, you may need to isolate for longer, and that's a good thing to discuss with your healthcare provider. There was a question earlier about, are we still contact tracing? And just to address that, for COVID-19, the Department of Health is no longer doing contact tracing in the sense of calling to find out who were the contacts and trying to identify all those contacts and tell them to isolate. But we still do case investigations. And so what's the difference between contact tracing and case investigations? Case investigation is for certain situations where we may hear about an outbreak, for instance, or if we have a case in a very sensitive setting like the memory care unit of a nursing home, then we may still do a more in-depth investigation to try to make sure that that illness doesn't spread in a setting where it could cause real harm. So that's still happening, and so we do find out a lot about certain cases that get reported to us.
Hilton, this question's for you from Ingrid on Facebook. Are hospitals and medical centers and clinics requiring masks again?
In general, yes, especially now as there has been an uptick, as we've talked about, and as we're heading into the flu season. So the recommendations are that if you're in a, well, most of the staff, especially in clinical areas, will be wearing masks. They may not be wearing N95s, but they at least will be wearing a surgical mask. We meet with the hospital chief medical officers on a regular basis, and the chief medical officers talk to each other about what they're doing. We're trying to be as consistent as possible across the state in terms of what's happening. So there is still, it's still good practice to wear masks if you're in an environment, a hospital environment. You have people there by definition who are sick, right? Now, they may not all be COVID, or only a small percentage have COVID, but you don't know what people have, what they've been exposed to, and so taking precautions like wearing a mask is still a very good thing to do when you're in a hospital setting.
Angela, Sharon is asking, what kind of treatments are you getting or have gotten for long COVID? I know you mentioned or touched on it a little bit, but can you share a little bit more?
Sure. Most of my issues were centered around my brain, neurological issues, severe major depressive disorder. I didn't get any kind of assistance from any of the medications that I took. They just didn't work for me, and that's kind of the case for long COVID patients. So I turned to a treatment called transcranial magnetic stimulation. It's not alternative. It is actually covered under insurance if you've failed several medications for antidepressants. And basically what it does is it helps when you get sick with long COVID or a neurological condition, your brain is in arrhythmia. So there's parts of your brain that are working too slow and too fast. And it was actually showing up on my brain maps and my EEGs. And so once I started getting treatment, that helped get my brain out of arrhythmia and back on track. And thankfully, my insurance paid for it. So it was kind of like the lights coming on and seeing things in 3D. Once I got back to myself, the world just kind of, it was like opening the doors and the windows, and everything became so colorful, and my hearing was back on track, my paying attention was back on track, my executive function was back on track, and my depression just melted away. So I'm very grateful for that.
How many treatments did it take for that to happen?
Insurance pays for about 36 treatments, so I did the full 36 and a few extra. I ended up joining the company so I can go in and get treated whenever I need to. But I see a lot of long COVID patients coming through the clinic who, just like me, have tried just about everything and nothing works. And once they're able to get their brain treated and get well neurologically, things kind of come back to life.
Mm-hmm. Yeah. Dr. Devendra, maybe you can touch on this. We've got a couple of long COVID questions from our viewers. Are people with long COVID contagious?
No. People with long COVID aren't contagious for COVID. Now, there is some thought of some viral persistence, and for the national COVID trial called RECOVER, there's one section that is looking at viral persistence, and they are looking at use of Paxlovid in that situation. But that's, at this point, it's all experimental. Whether there is actual communicant virus, it's probably not.
I also wanted to ask this question for you, doctor. This is from someone, or viewer from Pearl City, saying most people who have long COVID got it from the first variant. Can you get long COVID from the newer variants? Maybe you can also touch on his first part of that comment as well.
Yes. So, yes, you can get long COVID from any of the variants. I think it's really harder to get some of the data just because right now a lot of people are getting COVID and we don't know the denominator, because really a lot of these patients are testing at home, they're doing their own tests, they're self-isolating, and we don't have all the data. So that denominator, if you wish, is probably much larger than that we know of. So I can't really give you an incidence of what the incidence of long COVID is with each of the variants. Maybe I'll defer that to Sarah as well.
No, you're exactly right. So with the shifts in testing, initially people were only getting tested in a setting where all those results get reported to the Department of Health. The expansion of testing through self-testing was a great thing because it made testing much more accessible, but it's a trade-off. So there's less visibility into what's the denominator, what is the total number of people who are getting COVID-19 right now.
And I can even say from personal experience, I've nearly fully recovered in May of last year, and then in July I got COVID again, and even though I was vaccinated and got treatment, my long COVID reignited from that new variant that I got last July. And so now I'm in recovery at 90%, but still that was a completely different variant than what I got the first time.
Yeah.
And I still do see patients who come to me and said, you know what, I got COVID in the beginning of the year and I still have persistent symptoms. And so I still see patients coming to clinic presenting with long COVID, even though they got it from an Omicron variant versus an Alpha or Delta.
With the current variant that's going around, what are some of the symptoms that are most common, or does it vary from patient to patient?
Well, like the most recent variant, I think the one that is most populous is the EG5 variant that is out there. And that one, you still have the same symptoms. it starts as an upper respiratory issue. And so those are the things that you would see with that.
Are we still seeing a lot of patients that lose their sense of taste and smell, that sort of thing?
Yes, we still have people lose their sense of taste, their smell. We still see those symptoms as well.
Dr. Kemble, this one is from a viewer commenting on Facebook. I heard that I can test positive on a home test for up to 90 days. How on earth am I supposed to know when I can end my self-isolation?
So using self-test kits is a little bit more erratic. It can be harder to interpret. Often with antigen-based testing, which is what's in the self-test kit, you don't stay positive for as long, but it's true some people can stay positive for a very long time, even on antigen testing. I'd say those are difficult situations to interpret. You probably want to consult your healthcare provider, but generally speaking, if your symptoms have fully resolved and you've waited the time period that's recommended, those 5 to 10 days, depending on how long your symptoms last, it's okay to stop isolation. Now, masking is another precaution that people can take. So if you're living in a household with someone who's very vulnerable and you're worried about that persistent positive test, in addition to talking to your primary care physician, which I would recommend, I would also say you can continue masking to protect others in your household.
Dr. Kemble, since we're on you, June is asking, I've taken all the COVID vaccine shots and yet 2 months ago I got COVID and got very sick. What's the point of getting the vaccines?
Vaccines are very effective at preventing the worst outcomes of COVID-19, but they're not 100%. We don't have any 100% prevention, absolute prevention methods. So it is still possible to get sick after getting vaccine. What we do know is you look at the overall numbers, your chance of getting very sick is far less if you've had the vaccine than if you didn't. You never know what your illness might have looked like if you hadn't been vaccinated, and would you still be here today? So I think those, just looking at vaccine efficacy, those are the studies that are done to say if you look at similar populations, what's the outcome for those who were vaccinated and weren't? And we definitely see a very strong benefit to being vaccinated.
I know the topic of getting vaccinated for some can be controversial. We have someone who wrote in saying, my friend does not believe in the vaccines, says they haven't been tested properly and she won't get them. What do you say to a person who feels like that? I think this is a question that maybe everyone can chime in on.
And I think we've all had conversations with people who feel that way. And for some people, getting vaccinated is a very personal decision. I always lead with the data that I know and what I would recommend to myself, my family. I recommend my parents to get vaccinated, my kids to get vaccinated, because I really do believe that the evidence shows the benefit of the vaccines. I think also keeping in mind that millions of people have been vaccinated with the COVID vaccines, and so these vaccines have one of the best safety records of any vaccines known to man.
If I can just add to that, when people say that to me, the vaccine hasn't been tested, there's been no vaccine in history that has been tested to the extent that the COVID vaccines have been tested, because we've never in history given so many people vaccines over such a large period of time around the world. So every demographic, every race, every sub-race, all the mixtures have received the COVID vaccine. Now, I'm not saying everyone's gotten it, but there are, I don't know how many vaccines have been given, but there has been no vaccine that has been tested more in terms of the human population than the COVID vaccine. All the other vaccines we have, have not had anywhere near the exposure in terms of a worldwide population that the COVID vaccine has had.
Dr. Devendra, what about for you? What do you tell your patients?
Well, I first ask why. What are the reasons why? What are the barriers? Try to figure out, because as Dr. Kemble said, it's a very personal decision. So I try to ask why. What are their barriers to getting the vaccine? Some would say, well, my sister got sick after getting the vaccine. And I say, well, that's also a sign of a very healthy immune system, that you're mounting in a good immune response. So I think really it is to find the reason why, and then from the reason why, try to say, I think this is the best thing for you, especially with your underlying disease, your underlying illnesses. I don't want you to get worse. I don't want to see you suffering. I don't want that. And really approach it from that
Angela,
avenue.
Angela, do you ever have conversations, just maybe in your everyday life, with people where, you know, you're talking about should you get vaccinated and you share your story? I'm curious what you say.
All the time. There isn't anything that I can say that may not change their mind. But the first time I got sick, I was sick for 8 weeks and wasn't even sure I was going to live to see the next day. The second time I was vaccinated, I was only sick for 5 days. Yes, I ended up reigniting my long COVID, but I was sick for 5 days and I was able to handle it. I think it is a very personal decision, and I think that you have to remember that there are people around you, your loved ones, kupuna, people with all kinds of medical issues, and you don't want to expose them to that, your loved ones to that. So even though you might be fine, you really have to think of the people that you love around you and do it for them.
Dr. Devendra, how many annual vaccines can our human body handle? I know for our kupuna, the shingles series of shots is being recommended, and then there's also the pneumonia shot. We talked about RSV and flu shot. Can you speak to that?
I think the shots that you are recommended for your age group, you should get. And so there's no like limit to how many shots you can, as long as these recommended shots that for your age group should be given. I don't think there's any say you can't have so many shots. I don't think that's the way the immune system works.
One way of thinking about it is our immune system exists because we're exposed to infections all the time. It's built to see all kinds of different infections, and so just in the natural course of a person's life, you're seeing as many antigens presented, if not more, than what you're seeing through vaccines.
Hilton, do you feel like people have tuned out COVID-19?
I think a lot of people have. People talk about COVID fatigue, certainly in terms of masking, the hand washing, the social distancing. You know, it lasted probably in Hawaii. We did very well overall. You know, Hawaii did remarkably well compared to the rest of the country. You know, for the last numbers I saw, we had the lowest death rate for the entire duration of the pandemic in the entire nation, and one of the lowest infection rates. So we did really well as a state, that even though we have generally people, you know, who do take care of themselves in their community, they are concerned about, you know, their co-workers, their families. You know, people did get tired of that. They said, look, I'm sick of wearing a mask. I'm sick of doing all this hand washing. I want to go out. I want to, you know, mix with people. So there has been, you know, I was on a plane yesterday. I flew back from DC yesterday. In the entire plane, there was probably maybe 10% of the people on the plane were wearing a mask, even though there's there is concerns about flu, RSV, and COVID. So yeah, there is this, you know, natural evolution that you go through with any type of disease state or stress state, where people say, look, I'm over it. I'm just going to take my chances, and that is unfortunate. You know, because as I said earlier, you know, the evidence clearly demonstrates, just as we saw with the flu in 2020 and 2021, if you take precautions, you can dramatically, flu was still out there, right? It didn't go away, but there was a dramatically lower incidence of the flu because people were taking good public health precautions.
Hilton, I have a question for you from Malia from Hilo. Do the hospitals and other healthcare facilities in the state meet regularly and share data about COVID, and is that information shared with the government?
Absolutely it is. So we work very, very closely with the Department of Health. We really appreciate the very close collaboration. We have meetings on a regular basis with all the different segments of the healthcare community. So our long-term care administrators get together at least once a month to talk about what's going on. Home care, hospice, assisted living, hospitals. We have our acute care leadership, which is the executive leadership, meets on a regular basis. Our chief medical officers meet on a regular basis. Dr. Fink, who's the director of the Department of Health, he collaborates on those chief medical officer meetings. So there's a lot of information sharing that's going on, and we listen to what the CDC is, you know, saying. We listen to what Department of Health is saying. We all work together to collaborate and figure out what's best for the people of Hawaii.
Dr. Kemble, do you feel like there is any chance that we could go back to where we were in 2020 as far as a shutdown, or are we way past that with what we know about COVID?
I think it's really unlikely that we would see a full shutdown happen again. We're in a really different place with COVID-19 than we were before. And a lot of that is, as we were talking about earlier, the levels of population immunity that we have now. Early on, people were talking about herd immunity. Well, in a way, we're as close as we're going to get to herd immunity for COVID now, which means that even people who didn't choose to be vaccinated have, many of them, nearly all, have had COVID. And so there's some level of immunity there. So that really has shifted, as we were saying before, how much hospitalization and severe illness you see as a result of another surge in COVID infections. So as long as the variants continue to be responsive to what our immune system has built up, so that we're able to fight off the worst effects, I don't see us going back to a place where we're having that kind of full lockdown.
That's good to hear. I'm sure no one wants to go back to 2020. Angela, for any of our viewers who maybe they know somebody who had a story similar to you, or maybe they themselves had a story similar to you, what would you like to say to our viewers? And is there maybe any way they can get in contact with you if they want to know more?
Well, there is hope. There is definitely hope. And I think the biggest thing is to be an advocate for yourself. And if you know someone who has long COVID, to be an advocate for them. It takes lots of resources. It takes lots of research. It takes lots of trying to find physicians who you're able to see. I work at Brain Health Hawaii, and they can find me on the website, call the clinic, and reach out to me. I get emails and messages from people from all over the world asking for help for long COVID. I think everybody's a little different, and it affects them all very differently. So there are different modalities and different things that people have to try or need to try in order to get themselves well. But there's one thing that I have to say for long COVID patients: get yourself outside. Get yourself in the sunshine. Let your eyes see the light outside. Get around people, and if you don't feel that you can be around people in crowds, make phone calls, get engaged with people with text messaging, with emails, with Zoom, however you can. When I was going through treatment, what I would do is I would force myself to leave the clinic after treatment and go to the mall and walk around and be around people, and I forced myself outside because we tend to isolate ourselves when we have long COVID. So
I do want to camp on that, because I think the mental health aspect of this is so crucial.
Yes, it is.
Making sure that you're well. Also, what Hilton was saying, be good to yourself. Mental health, diet, exercise, etc.
I think that's something that you mentioned earlier, the exercise portion of it, just being healthier in general is really important. Was speaking to other people that maybe were going through the same thing that you were helpful as well?
Yes, and it's amazing how when you start speaking with people, how you realize how similar your symptoms are, and it's like, oh, I went through that too, and oh, I went through that too. So speaking to people about it and finding communities where you can be open and share and have that camaraderie of me too, that I also faced those kinds of things. It can be very empowering because we all give each other hope and lean on each other in those times with long COVID.
Hilton, do you know, do our medical facilities provide counseling or therapy for patients with long COVID?
Yes, they do. We're very, very fortunate to have physicians who are starting to specialize in this. We have a very, very robust healthcare system here in Hawaii. Very, very pleased with the type of capabilities we have, the resources we have, the ability to share information, learn from each other. So we, while it is becoming a very, sort of being, not sure if there's a board certification for it yet, there may be at some point in time, but, we are learning from each other. We are figuring out, what it takes. And going back to what Dr. Kemble was saying about the chances of the state shutting down, we know so much more about how to treat the disease now. And so because we know we have the vaccinations, we have the immunity, we have so much better treatment, we are much more readily able to detect if people have COVID. So we're in a much, much better place than where we were in 2020. Now, that being said, there is always the potential for other diseases to come. So we do need to be vigilant, we do need to be careful, and we've learned how to react. We can develop vaccines in a very short period of time. This is, the mRNA vaccines, that had never been done in human history before. So we have that ability to do that again if we need to. We hope we never have to face it, but it may still happen. Those risks are still out there.
Unfortunately, we have just one more minute. So Dr. Kemble, I'm going to give sort of the last comment question from Cindy from Kaneohe to you. She's asking the panel to talk about best practices. I know we've touched on that throughout the last hour, but as we head into the holiday season, Halloween, Thanksgiving, Christmas, family gatherings, what can our viewers do to stay healthy?
I think the number one thing, as we've all been saying tonight, is get the updated COVID shot. That's going to be a great way to protect you if you're going to be doing things in more crowded situations. And for those who are at high risk, you may want to think about wearing a mask during those times when you're interacting with a lot of other people. That's still an effective tool in the toolbox.
Vaccine, mask up, hand sanitizer, I'm sure.
Hand sanitizing is very key. I mean, if there's anything, that's one thing in combination with all of what we've talked about, hand sanitizing is key. I think one of the biggest things, just to underscore what Sarah has said, definitely vaccinate, get your flu shot, get your COVID shot. If you're in the correct group, get your RSV shot. I think those are going to be really important things to as we go into this next season.
Yeah. And if you don't feel well, stay home.
Yep,
Yes.
that's a good one. Stay home. Well, mahalo for all of you for joining us tonight. And we also want to thank our guests in studio, Dr. Sarah Kemble, the state epidemiologist, Dr. Gehan Devendra from Queens Medical Center. Thank you for being here. Hilton Raethel from Healthcare Association of Hawaii, and Angela Keene, long COVID survivor. We are so glad that you are feeling much better.
Thank you.
The devastating fires in Lahaina have had a massive toll on many of us statewide. Next week, we will talk to mental health experts about the challenge of coping with the effects of the disaster. Please join us next week. I'm Lauren Day for Insights on PBS Hawaii. Have a great night.
Local broadcasts of Insights on PBS Hawaii are made possible by the support of viewers like you. Mahalo.